Hi, my name is Dr. Kenneth Gundel. I'm one of the resident orthopedic surgeons at Seattle Children's Hospital, the University of Washington, and Harborview Medical Center. Today, I'd like to share some thoughts about X-rays and radiation exposure. Since their discovery in 1895, the use of X-rays has greatly expanded the ability to diagnose and treat many conditions throughout the body. Perhaps most of all, it has aided incredibly in the provision of fracture care. Unfortunately, even at its inception, we learned that too much exposure to radiation could cause cancer, and this unfortunately claimed the lives of some of its early pioneers. With the advent of computed topography scans, or CT scans, we've gained an ability to use X-ray technology in a complex manner to develop incredibly detailed images of the body. These do have an increased radiation exposure and potentially a higher risk. And therefore, you may have read recent reports in the news about fears over radiation exposure and potential increased risks of cancer in people who have had CT scans. This has led me to meet many people who often become concerned about the radiation exposure from a few X-rays of the hands and feet during the provision of fracture care. I'd like to point out just how different the amount of radiation exposure is between these different modalities. With the use of a table, as well as a very insightful diagram, I'd like to show how these different technologies relate to radiation exposure. I hope to show you that actually throughout the entire course of treatment for a forearm fracture or a leg fracture, the amount of radiation received is pretty comparable to spending a summer outside playing, and certainly less than a single flight from Los Angeles to New York City. Understanding radiation dosing and the scale and magnitude of how different imaging procedures relate to radiation exposure is difficult. One way to make it easier is by looking at it graphically. This is a radiation dose chart, and we'll be using it to help us understand better how different medical imagings relate in terms of their scale and dose of radiation. So let's start by some very kind of simple everyday activities. I like that they note that sleeping next to another person is 0.05 microsieverts. That's 10 to the minus 6 is micro. Eating one banana, interestingly, is 0.1 microsieverts. And here we see that an arm X-ray is 1 microsievert, so it's actually worth 10 bananas. Whereas staying somewhere a bit higher than usual, such as the Colorado Plateau, is actually more each day than an arm radiograph in additional X-ray exposure. A dental X-ray is about 5 arm X-rays. And really key here to understand is that our background dose received by an average person in one normal day is 10 microsieverts, which is 10 arm radiographs. And an airplane flight from New York to LA, due to being at higher elevation, is 4 times the normal average daily dose and 40 times a single arm radiograph. And I think that's something that most people don't think about when they travel by air. Now, if we take all of the amount in this blue boxes, that's a total of 60 microsieverts. That's 6 days of average normal background radiation and 60 arm X-rays. You can see that a chest X-ray is 20 microsieverts, so 20 arm X-rays, or about 2 average normal background radiation days. Looking at some other medical related issues, a mammogram is actually quite a bit higher at 400 microsieverts, so 400 worth 400 arm X-rays or 20 chest X-rays. And when you start to look at a head CT scan at 2 millisieverts, so that's now 10 to the minus 3, each millisievert is 1,000 microsieverts, that's more significant. That's a head CT scan being 2,000 arm X-rays, or 100 chest X-rays. And then here, good to keep in mind that 4 millisieverts is the normal yearly background dose, about 85% of which is from natural sources. Now let's compare that to a chest CT scan. At 7 millisieverts, that's 7,000 arm x-rays, and almost twice the normal yearly dose of background radiation, you're talking about a more significant exposure. This is just an interesting point that the U.S. government would allow a radiation worker to accumulate 50 millisieverts per year, maximum. So now let's increase our scale yet again. Everything in the green part of the chart combined is 75 millisieverts. At 100 millisieverts, or 100,000 arm x-rays, is the lowest one-year dose that has been clearly linked to an increased risk of cancer, although many sources will point out that there really is no safe dose. It's just about scale and risk. And then up here you're getting into more serious things about severe radiation poisoning at 2 sieverts, and at 4 sieverts it would normally be fatal. And then 8 sieverts is considered generally to be fatal. So I hope that this chart overall can help you understand a little bit the scale and about how talking about an arm x-ray is not the same thing about talking about a head CT, a chest CT, an abdominal CT. Another source that is useful and available for free is radiologyinfo.org. It has a huge section on patient safety, including this very helpful chart on radiation dosages, much like that infographic, which you can see throughout. And I would really encourage you, if you're interested, to go look at this more. You can also download a medical imaging history form that you can keep with you to help decrease the chances of any imaging studies needing to be repeated, or if you want to keep track of your radiation exposure. And again, that infographic can be found online. You can see here it was done by Randall Monroe at the Reed Research Reactor. I hope that these tables and diagrams have helped provide some context to you about X-ray radiation exposure. Hopefully you've seen that comparing X-rays of the arms and legs to CT scans is a little bit like comparing apples and oranges. Hopefully this will lessen fears about getting necessary X-rays for the treatment of fracture care, and also provide some information for you and providers to make informed decisions about the rational use of CT scans. Certainly it's always good to minimize unnecessary treatments, be they imaging scans or other treatments. And there is also very exciting technology on the horizon, some of which is already in use, that can further dramatically lessen the radiation exposure even from CT scans. If you're interested in this topic and would like to learn more, I'd encourage you to visit radiologyinfo.org, the link of which is available in association with this video, to gather more information. Thank you for watching.